The integration of AI into healthcare has accelerated rapidly, promising a future in which diagnostics are faster, triage is more efficient, and patient monitoring is more precise. AI systems can analyze massive datasets, identify subtle patterns in imaging or lab results, and provide clinicians with decision support recommendations that may have been difficult for humans to detect. In some scenarios, AI has already demonstrated its value. Algorithms can flag early signs of diseases like cancer in imaging scans, predict risks for complications in chronic conditions, or monitor vital signs in real time to alert medical teams to emerging issues. These capabilities have the potential to enhance patient outcomes, reduce errors, and optimize healthcare workflows, making medical care more accessible and efficient. Beyond diagnostics, AI offers tools for patient support and management that are particularly useful for routine or high-volume tasks. Chatbots and virtual assistants can remind patients to take medications, track symptoms, provide educational resources, or offer guidance on minor health concerns. For hospitals and clinics, AI can help streamline administrative processes, schedule appointments, and triage non-urgent cases, freeing human staff to focus on complex or acute care. In these capacities, AI functions as a helpful assistant, augmenting human capability rather than attempting to supplant it. Its strengths lie in consistency, speed, data processing, and capacity to detect patterns across populations or large datasets, tasks that are laborious and time-consuming for human clinicians. However, as promising as AI is, there are significant warnings about the potential dangers of replacing human clinicians. Healthcare is fundamentally relational, ethical, and context-sensitive. Diagnoses and treatment decisions involve more than pattern recognition. They require moral reasoning, holistic understanding of patient history, consideration of psychosocial factors, and the ability to interpret ambiguity. AI may misclassify rare conditions, fail to account for nuanced patient contexts, or offer recommendations that appear technically correct but are unsafe when applied in practice. Over-reliance on AI without human oversight risks not only medical errors but also erodes the clinician-patient relationship, which is essential for trust, adherence, and emotional support. Patients often need empathy, reassurance, and explanation, qualities that AI cannot genuinely provide. Even the most advanced models generate responses based on probabilities and prior data, not on understanding, compassion, or ethical reflection. The use of AI in Triage illustrates this duality. AI can effectively prioritize cases based on severity indicators, flagging patients at higher risk and reducing wait times. Yet when algorithms are relied upon as a standalone decision-maker, mistakes can have serious consequences. Vital signs or lab values may not capture subtle contextual cues, patient-reported pain, behavioral changes, or cultural considerations that are critical for accurate assessment. AI may also reinforce systemic biases present in training datasets, leading to unequal care outcomes across different populations. Without human clinicians to interpret results and contextualize recommendations, these risks are magnified. There is also the psychological and ethical impact on patients to consider. Patients may overtrust AI, assuming that its speed, technical sophistication, or statistical precision guarantees correctness. In moments of anxiety or uncertainty, patients may prioritize algorithmic advice over professional consultation, potentially delaying necessary interventions. Moreover, patients' rights to informed consent, individualized attention, and personalized care can be compromised if AI is treated as a replacement rather than a support. Privacy concerns compound these risks. Sensitive health data used to train or operate AI systems must be protected rigorously, yet breaches or misuse remain possible. Despite these concerns, the future of AI in healthcare can be highly positive if implemented responsibly. When AI is paired with human oversight, it can enhance decision-making, reduce cognitive load, and improve operational efficiency while preserving the relational and ethical dimensions of care. Clinicians can leverage AI for pattern recognition, predictive modeling, and administrative assistance while retaining ultimate responsibility for judgment, intervention, and communication. Hybrid models, where AI acts as an analytical and operational tool, and humans provide interpretation, ethical reasoning, and compassionate care, represent the most promising path forward. Education, transparency, and boundary setting are critical in this future. Patients and clinicians alike must understand what AI can and cannot do, recognize its limitations, and maintain accountability in decision-making. AI should be viewed as an augmentation rather than a replacement, a sophisticated tool to support human expertise rather than supplant it. Regulatory oversight, continuous monitoring for bias and errors, and robust data protection are essential to ensure safety, fairness, and trust. In conclusion, AI in healthcare embodies both remarkable potential and serious risk. It can revolutionize diagnostics, streamline triage, and provide patient support in ways that improve efficiency, accessibility, and even outcomes. Yet its limitations in understanding, empathy, and ethical judgment make human clinicians irreplaceable. The greatest benefits of AI will be realized when it is positioned as an intelligent assistant, complementing, but never replacing, the critical reasoning, relational skills, and moral responsibility that only human healthcare professionals can provide. Failing to respect this boundary could lead not only to errors and inequities, but also to a depersonalized healthcare system where technology drives decisions at the expense of human connection and nuanced care.